The bottom line is, on your own, you have to save a lot more to get to the same place because you have to cover all these additional risks. And so retirees, how that's going to happen, how they're going to have enough meaningful income when they retire, is an open debate and an open concern. Underneath pensions and savings lies Social Security, our focus for this morning. It reaches 94% of the workforce. It provides a modest but steady and indexed annuity. Is it secure? My own answer is that, yeah, we need to do a little work, but basically it is in good shape. This is not health care. This is a different animal here, and we need to keep that in mind. The impact on the budget, the impact on everything between health care and between Social Security is radically different. This is not 1982-83 when we had the Greenspan Commission. I was on the Ways and Means Social Security Subcommittee staff at that time. And at that time, we were rapidly depleting the retirement program's trust fund. In fact, the 83 amendments were signed into law on April 20th. And we had been told that if we did not have new cash coming into the trust funds by May 1st, that the program could not have paid the full July 1983 cost of living increase because the trust fund would be zero. And benefit payments would be dependent completely on new tax revenue coming in. So I think it's worth noting, this is not like the $250 thing you see hanging around being discussed today. There was supposed to be a COLA in 1983. The problem was we weren't going to have the money to pay it. The trust fund went from zero in 1983, or very close to zero, and it's projected to go up to about $4.3 trillion in a couple of years from now. So that's quite a jump from zero to $4.3 trillion. It tells you what's been happening in the Social Security program, unlike what's been happening in health care. Today we're looking at a program that has had the positive impact of actually reducing the overall federal deficit every year since shortly after 1983. We've been bringing in more than we've been paying out. And tax income alone is going to continue to exceed the outgo for another 7 or 8 years. If you add in interest, you've got another 14, 15 years from today when the trust fund is going to continue to grow, estimated to reach that $4.3 trillion at some point. And then we have another decade or so before we get back to the point where I stood in 1981, 82, and 83. And I still remember some lady calling me up, and she was really upset because there were some housing bonds in the trust fund that were getting about 3% interest, which actually looks pretty good now. But it was very low for back then, and she was really upset at this horrible investment that had been made back during the Johnson years. And it was one time I just stood up, took a deep breath on the phone, and I was happy to say, "Ma'am, we sold those a long time ago." So it was the good news, but it was the bad news. We don't want to repeat the early 80s. So we do have some challenges ahead, some adjustments to make. But first we might want to ask, where are we trying to go, and how are we going to provide retirement income security? For that, I'm going to turn the discussion over to our panel. The first is Ken Apfel, who is former Commissioner of Social Security, and he is going to outline key issues in benefit adequacy and benefit solvency. The second is Danny Franklin of the Benenson Strategy Group, who will present the findings of the survey regarding views on Social Security that they conducted for NASI, and that is one of the reports in your packet. And the third is Virginia Reno, who is Vice President at the Academy and who's going to outline the findings of today's report. Each is going to talk for about 10 minutes, and then we have plenty of time for discussion. Thank you.